and we are looking for possible lesions that might justify being stabbed but by someone that just wasn't there. Was it a poltergeist? The cause of the pain? It is, and it's a very insidious and quite uncommon disease. So we have here a CT scan of the chest of a young female who got to the hospital saying she was all alone at home and suddenly felt a very sharp and intense stab to the back of her chest, as if she was stabbed to the chest and suddenly she couldn't breathe and that pain just won't go away. So she got to the hospital and the doctors ordered a CT scan. So this is a CT scan of the chest of a young female who complains of a sharp, intense and sudden pain to the chest. As you may know, we have to look at these images and read the exam in at least 3 windows. We gotta look for soft tissue lesions, mostly because she said she felt like she was stabbed, so we have to see if there is some kind of soft tissue laceration or any other kind of damage. Also, we have to look at bone window to see if we can spot any bone damage and bone lesions. And of course, we have to look at the main course of this analysis, which is the lungs. So let's start with the soft tissue window. This is the soft tissue window. As you may see, the lungs are all black, just like the air around the patient. And we are looking for possible lesions that might correlate to the complaints of being stabbed but by someone that just wasn't there. Was it a poltergeist? Let's see. We can see the rib cage, the spine. We can see soft tissue, the breast, the muscles, the subcutaneous tissue and the skin all over. I just roll up and down the images looking for lesions. I can see there is some kind of edema. That's probably because she was laying down on the bed at the ER for far too much time. The axillary regions, I can see no lymph node enlargement. It's okay, breasts are symmetrical. And I can now go to the thyroid, the neck base, and the mediastinum. The mediastinum, the heart, and the great vessels are okay, but as you have noticed, probably there is some kind of small, really tiny pleural effusion on both sides. So this is kind of a pleural thickening and effusion on both sides of the chest. This can justify a sharp respiratory dependent pain to the chest. Oh, and she said the pain is mostly localized to the right, so it's a right-sided pain to the chest out of nowhere that prevents her from breathing straight. So let's go now to the bone window, see if we see any cracked ribs. The sternum is okay, the rib cage seems fine. We can read the images of the spine on the axial view, just like this, and I always advised people to hit the MPR button and check the spine on the sagittal view, just for the sake of not missing any major lesions. And of course, Wheezes wasn't maximized. I just forgot to do that. So let's roll images. No. Apparently the spine is fine. And finally, we are going to check if we can see why the patient is feeling pain on the lung window. So we are going to see, oh, that's it. I'll put the mediastinum, the soft tissue window, just beside this one, just to make it more clear. We haven't seen anything wrong on the soft tissues nor the bone, so there is no trauma, there is no laceration, there is no actual puncture wound to this patient. We just saw a little bit of pleural effusion bilaterally. So this isn't a trauma case. This must be some kind of uncommon disease. And I know you probably have already seen the motive of the disease, the cause of the pain. It is a spontaneous pneumothorax. It is a pneumothorax that arose without trauma, and it's a very insidious and quite uncommon disease, usually affecting young patients, longilineal young patients, those tall and thin patients, usually males, and it's right here. You see the lung is reduced in volume. We can see some atelectasis to the middle lobe and to the upper lobe, and a small to moderate pneumothorax. I can't really tell where it came from, but I could guess it came from a small blob of air right at the apex of the superior lobe, which is the most common cause of such disease. So, as you know, we have also a bit of fluid, so this makes it a hydropneumothorax, not just a simple pneumothorax, which is quite common because there is pain, there is kind of a pleural inflammation to this case. So this is a surgical case. This should go to chest drainage on the surgical center, or at or in the surgical center, and the patient should be cured without major complications. So this is it. The ghost stab, the poltergeist this patient complained about was actually a quite uncommon chest disease called a spontaneous pneumothorax. So this is it. If you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click and keep watching, and until next time, take care.